Hi guys, I'm Dr. Sunil Sharma. Now today we will talk about Skullbase. The skull base. Okay. The skull base having two part. Exocranial skull base and endocranial skull base. Okay. It's having two part, exocranial skull base and endocranial skull base. Okay. Now exocranial skull base and endocrinal skull base is very important. It's very complex anatomy as surgically and morphological. It's consists of total 26 bones. Means if we remove the mandible, it consists of 25 bones. Total 25 bones. As you know, skull is made of 28 bone. 28 bone. In a skull base, mandible and parietal. Two parietal, one mandible. 28 minus 3 is 25. So a skull base consists of 25 bones. Now endocrinal skull base, the interior of the skull is formed by the 6 bone. Total skull, exocranial skull, that calvaria, cranium made by the 8 bone. If you remove 2 parietal bones, you will get 6 bone. This means this interior of the skull. Now if you see this is the endocrinal skull base. Okay, this is frontal bone, this is occipital bone, these two are temporal bone, one is ethmoid and sphenoid bone. So two paired bone, temporal, and rest one is total 6 bone. This endocranial skull base formed by the 6 bone. Now this skull, if we remove this mandible, okay, if I am removing this mandible, now see, this is called the skull base hole. This is exocranial skull base, this is endocranial skull base. This hole is endocranial skull base, interior of the skull base. This is norma basalis or exocranial skull base hole. Okay, we have removed this parietal bones both and remove this mandible. Okay, now we will talk about endocranial skull base. Now we will talk about endocranial skull base, or you may say anterior of skull. Okay, now this interior of skull hole, it extends from, now it extend from this. This is the posterior table of frontal sinus. Here you can see this is the frontal sinus. So extend from anteriorly posterior table of frontal sinus. Okay, to this internal occipital protuberance. To occipital protuberance. internal occipital protuberance, and laterally both temporal bone. This is anterior, laterally temporal bones. This is the extension of anterior of the skull, or may say endocranial skull base. Now, this endocranial skull base again divided into three parts. Anterior cranial fossa, middle cranial fossa, or posterior cranial fossa. Okay, now anterior cranial fossa is external from frontal sinus, posterior level of frontal sinus to the lesser wing of sphenoid. Okay, if you see, this is the posterior table of frontal sinus to this lesser wing. These are the lesser wing. This is the sphenoid one. These are the lesser wing of sphenoid. This is lesser wing. This is the body, jugum sphenoid. This is the body of sphenoid. So this is the till the posterior border of the lesser wing of the sphenoid. This is the anterior cranial fossa. Middle cranial fossa extend from body and lesser wing of sphenoid to the superior part of petrous temporal bone, to the superior border of petrous temporal bone. Now this posterior cranial fossa extends from superior aspect of the petrous temporal bone, superior border of temporal bone to the this internal occipital protuberance, or you say occipital bone. Okay, this is the extension of this posterior cranial fossa. Now, surgically or morphologically, you can divide this middle cranial fossa. Middle cranial fossa again divided into three parts. This middle cranial fossa again divided into three parts. Midline sagittal of midline sagittal, or you say para sagittal, or lateral skull base. Lateral skull base. Okay, this is the whole. This is the posterior cranial, middle cranial fossa. This again divided into three parts: midline sagittal, off midline parasagittal, or lateral skull base. If you draw the line, this is the petroclival fissure. If you draw the vertical line through this petroclival fissure, in between two vertical lines going through petroclival fissure, this is the midline sagittal. If we draw one line from lateral to foramen ovale, this is the foramen ovale, you will see in between the petroclival vertical line or this lateral border of ovale, you will see the off midline parasagittal, or lateral to this vertical line extending from lateral to lateral margin of foramen ovale, you will get the lateral skull base of the mid cranial fossa. So this is again midline sagittal, off midline sagittal, lateral skull base. Okay, this surgically, if you are approaching through endonasal approach, you will get this pituitary fossa, that is the middle cranial fossa. This approach is called midline sagittal approach. If you are considering this cavernous sinus or you are approaching the cavernous or foramen ovale, foramen lacerum, this approach is called parasagittal approach, okay, or of midline sagittal. If you are approaching lateral to this is called lateral skull base. Lateral skull may assess endonasally or as well as from the this uh, lateral skull base approach like mustard approach and this zygomatic approach through labyrinthine approach, retrosigmoid approach, and posterior fossa. This is retrosigmoid and retrooccipital approaches, suboccipital approaches. Suboccipital and retrosigmoid approaches are also is mainly lateral retrosigmoid and suboccipital approach are included in this posterior fossa. But infratemporal fossa, middle temporal fossa is also considered in the lateral skull base approaches. Okay. Now we will talk about important structure anterior of the skull. Now we will talk about anterior cranial fossa. Anterior cranial fossa. This is called this vertical crust in the midline of posterior table of frontal sinus is called frontal crust. Frontal crust. This gives origin to the fox cerebri. This is the dural extension which extends from anterior fox cerebri to the internal occipital protuberance. And this in between this elevated triangular bone is called crista galli. Crista galli. Crista galli is part of ethmoid bone. Is also the origin of the fox cerebri. In between this frontal crust or crista galli, you can see one pit. This is called foramen cecum. This is called foramen cecum. MCQ can be asked here. This is normally blind. Normally blind closed. Okay. But sometimes we have emissary vein. Emissary vein. Sometimes emissary vein which connect superior sagittal sinus to the nasal veins, nasal cavity. Okay. Sometimes mostly it's blind sac and some blind fossa it is closed, but sometimes may pass emissary vein that connect the nasal cavity to superior sagittal sinus. Around this crista galli, okay, this is the crista galli. You see this pit, fenestrated pit in the ethmoid bone. This is called cupriform foramens. Cupriform plates is fenestrated. Next is cupriform plates. Fenestrated cupriform plate having multiple foramen, mostly 15 to 20 foramen, fenestrated foramen, which transmit to 15 to 20 filaments of functional olfactory non-root plates. Okay, total neuron may be 6 million. 6 to 7 million, but MCQ will have 6 million. Total neuron is 6 million. Filaments are 15 to 20 filaments transversing the intake to nasal cavity, mostly in the superior part of septum and superior turbinate. This is the supplying 6 million axons of olfactory neuron which mainly detect the smell. Now in anterocranial fossa, you find this area. It's called this posterior to the area called jugum sphenoid. It is hard bone mainly, that is called jugum sphenoid. Now this is mainly about anterocranial fossa. Now we will talk about middle cranial fossa. Now anterocranial fossa extend up to the anterior node process. Posterior table of frontal sinus. This is the posterior to the posterior anterior node process. Anterior node process and posterior margin of lesser. This is the extension of anterior fossa. Okay, this is all about anterior fossa. Now we will talk about middle cranial fossa. B is middle cranial fossa. Middle cranial fossa extends from posterior margin of lesser wing of sphenoid anterior node process to the superior border of the petrous temporal bone. This is the petrous temporal bone and this is the base sphenoid. So this is extension of middle cranial fossa. If you see in between the body and the sphenoid, you can say this is optic canal. Now anterior structure is optic canal. What structure passes through optic canal is second nerve, that is optic nerve, important. Optic nerve and ophthalmic artery. Okay, and another important structure passing through this is sympathetic plexus around ophthalmic artery. So these three structures passing through optic canal. One is second nerve, optic nerve, ophthalmic artery, and sympathetic plexus around the ophthalmic artery. These three structures passing through this optic canal. Now, below this and lateral to this, you find this is the, if you see, this is the superior orbital fissure. Okay. Now, structure passing through superior orbital fissure. Superior orbital fissure. Okay. Superior orbital fissure structure passing through this. This is the, if you see, this is the lateral part, this is the median part. Below is median part. If you will draw the diagram of this is like this. This is superior orbital fissure. Medially it is enlarged. And this is optic canal above this. Okay. Structure passing through this most superiorly, this is superior ophthalmic vein. Most inferior to medially, this is inferior ophthalmic vein. Okay, this is whole is of superior orbital fissure. Okay, in between you see this is the frontal nerve. I will draw this frontal nerve, trochlear nerve, fourth trochlear nerve. Okay, anterosuperiorly. If we draw this is the fibrous ring of J. Okay, this is annular ligament or fibrous ring of J. This originate four muscle: lateral rectus, medial rectus, superior rectus, or inferior rectus. Okay, annular gin. This is the annulus of gin. This fibrous ring of gin originate force in between this. It's having both optic canal and middle part of the superior orbital fissure where it passes. This is superior division of oculomotor, third nerve, oculomotor nerve. This is inferior division of third nerve, oculomotor nerve. In between, you may see nasociliary nerve. Nasociliary is branch of ophthalmic division of trigeminal nerve. Nasociliary, this is branch of B1. And inferior ophthalmic here. In between here or this, you may have sixth nerve. This is sixth nerve. Abduction which supply the lateral rectus. Okay. This is the optic canal, and optic canal having this is optic nerve, and infrolaterally you will find this is ophthalmic artery. This is the end artery to the retina. Ophthalmic artery. Okay. So structure passing through superior orbital fissure are superior ophthalmic vein, inferior ophthalmic vein, third nerve, fourth nerve, sixth nerve. Okay. And recurrent branch of ophthalmic artery. Here, laterally one find recurrent branch of ophthalmic artery. Recurrent branch of these are structure passing through the superior orbital fissure. Now we will talk about simultaneously. I will talk about inferior orbital fissure. So you will get the structure passing through inferior orbital fissure. Inferior orbital fissure. Mainly B2 maxillary nerve coming from foramen rotundum, and branch of it that is zygomatic nerve. This is sensory branch. One zygomatic is also called facial nerve branch, but we are talking about B2 branch that is zygomatic nerve. Still coming from the foramen rotundum. Its branch entirely is divided by its branch emerging from the zygomatic itself maxillary nerve. And you may find infra orbital vessels. These three structures passing through this, I will show you infraorbital fissure. Okay. So this is the infraorbital fissure. Okay. This connecting the orbit to the infraorbital fossa. This is the infratemporal fossa. This orbit connected through infraorbital fissure to infratemporal fossa. Structure passing distance, you see this groove. This is the groove for maxillary nerve. B2 becoming here infraorbital nerve. Okay. And with infraorbital vessels, and one branch coming from this is zygomatic coming from this. These three structures passing through some emissary vein also passing through this. Some emissary vein. Okay. If you see diagram, this is infraorbital fissure. One main branch groove like is coming like this. This is B2 maxillary nerve. Some emissary vein passing through this connecting to infratemporal fossa to orbit, and this is the zygomatic nerve branch of itself coming from this, and infraorbital vessels. These are the content or structure passing through infraorbital fissure. B2 zygomatic nerve, infraorbital vessels. This is commonly asked MCQ. Okay. Now we will talk about a structure behind this is middle cranial fossa. We are talking about middle cranial fossa. If you see this, Here is cavernous sinus, and if you see this large foramen here, that is called just lateral to the sella turcica. Foramen is called foramen lacerum. This foramen lacerum, mostly lower part is covered by the cartilage. No structure passing through this foramen lacerum, but upper part having this. If you see from below, this is the carotid canal. It's open in the posterior aspect of this foramen, upper part. So I see a not coming from foramen lacerum, but it's coming from the carotid canal. So carotid canal open in upper part of this foramen lacerum. So I see a coming through upper part of the carotid canal. Sometime here you may have meningeal branch of ascending pharyngeal artery. Okay, meningeal branch of ascending pharyngeal artery may come through this foramen lacerum with some emissary veins, which are connecting this to the pterygoid plexus to the cavernous sinus. Pterygoid venous plexus to the cavernous sinus. Pterygoid venous plexus. So sometimes meningeal branch of ascending pharyngeal artery. If you see there is the pharynx, so this is ascending pharyngeal artery may come through this foramen lacerum and emissary veins. But carotid canal open in the posterior part, upper part of this foramen lacerum, and two structure which open anteriorly in the foramen lacerum. If you see here, but two structure that is forming the one canal is pterygoid canal, or you may say median canal. Median canal, which having medial nerve, or you can say pterygoid canal. Here you can see this is coming lesser petrosal nerve and one branch of facial first zero, that is greater superficial petrous, forming the median nerve. Median nerve formed by the median nerve formed by the greater superficial petrosal nerve or lesser petrosal nerve. This branch of the ninth and this is branch of the seventh. And sympathetic plexus around the carotid, forming the median of sympathetic plexus. Sympathetic plexus around the. So median canal having median nerve and sympathetic plexus around the this IC, internal carotid artery. So structure normally it's blind close by the cartilage. Sometimes meningeal branch of ascending pharyngeal artery or emissary may pass through this foramen lacerum. Normally it's blind. But upper part and posterior part is the IC opening, that is carotid canal opening in the foramen lacerum. Anteriorly one opening that is called pterygoid canal, which is also very important structure during nasopharyngeal angiofibroma surgery or any nasopharyngeal tumor surgery to identify the ICA. Okay, paraclival ICA may be identified by the median nerve, which open the pterygoid, sphenopalatine, foramen or pterygoid canal. Now lateral to this is just here. You see this is the foramen. If lateral to these are lateral to foramen lacerum, there are three foramen, anterior to posterior. If you see, okay, if you see this is the foramen lacerum, this is the sella turcica, okay, this sella turcica foramen lacerum. If you see there is three foramen, one small foramen anterior opening in the pterygoid, sphenopalatine foramen or pterygopalatine foramen. Lateral to this large foramen that is called oval shaped foramen ovale, and posterior to this This foramen is called foramen spinosum. Foramen spinosum. So these three foramen, this foramen rotundum, foramen ovale, and this small foramen, foramen spinosum, are situated in the greater wing of the sphenoid. But foramen lacerum is not situated in any bone. It is gap between the body of sphenoid, petrous temporal bone, and greater wing of the sphenoid. It is gap, not it's not going through any bone. But these foramen are part of the greater wing of sphenoid and structure passing through this. If you see, this is the foramen rotundum. Foramen rotundum, mainly structure passing through this foramen rotundum is maxillary nerve, V2, and emissary vein. Emissary vein which connect the talbot venous plexus to cavernous sinus, and this maxillary nerve passing through this. Here, if you see here, superior passageway, this macal scape forming three. Now, one is ophthalmic, maxillary, and mandibular. So, maxillary nerve and emissary vein passing through the foramen rotundum. This is very important MCQ. Okay. This foramen ovale, this is oval shaped foramen. This is called ovale. So, structure passing through foramen ovale. Foramen ovale are second, this is the mandibular, third division of trigeminal mandibular nerve. Mandibular nerve. Okay. Accessory meningeal artery. Lesser petrous nerve and emissary vein. Emissary vein, which again connecting the pharyngeal plexus to the cavernous sinus. So you may remember why this ovale having vein. So mandibular nerve, accessory meningeal artery, lesser petrosal nerve, emissary vein. These are the structures passing through foramen ovale. Sometimes there is meningeal branch of this trigeminal again passing through which supply the meninges of the brain. So these are the main structure passing that contained by foramen ovale. Now behind this, now this is last foramen, that is called foramen spinosum. Here, this is foramen behind this oval shaped foramen. This is called foramen spinosum. Because it's called spinosum, because here is you may find for this opening here. So this is called spine of sphenoid. That's why it's called the foramen spinosum. Structure passing through foramen spinosum are middle meningeal artery, middle meningeal vein, and meningeal branch of mandibular nerve. Okay, and sometimes there is, if you see this spinosum having this meningeal branch of spinosum, here is meningeal branch of ascending pharyngeal artery. Okay, these are the structure you may remember M3. Middle meningeal artery, middle meningeal vein, and middle meningeal branch of mandibular nerve. That is called the, also called nervus spinosus. Nervus spinosus, which also supply the meninges. Okay, these are the structure passing through this foramen. Now we will talk about some important other foramen, important in medical cranial fossa. One is foramen basilis. In between foramen ovale and spinosum, sometimes there is one foramen that is called foramen spinobasilis. If it is present, mostly it is not present, it passes lesser petrosal nerve. Then this nerve is not passing through foramen ovale, this nerve passing through foramen basilis if it is present. Now another foramen in between this foramen lacerum and ovale, one is foramen is called foramen of sphenoid daily. Okay, this is basilis foramen, this is emissary foramen, this is emissary sphenoid. It's also called emissary sphenoid foramen. Is passing through the steps passing through the emissary vein. Emissary vein. Sometimes it present between the foramen ovale here and foramen lacerum. Now we will talk about posterior cranial fossa. This is extend from superior border of petrous, this superior border of the petrous temporal bone to this internal occipital protuberance or this squamous part of occipital bone. Here it also entails external midline, the base sphenoidal and base occipital. In between these large foramen is called foramen magnum. And here you can see this is the another second largest foramen. This is the jugular foramen. And above this is small foramen that is called internal acoustic meatus. And here is called superior petrosal sinus ridge. Above this the petrous temporal bone. Here ridge is also petroclival ridge is passing through this foramen fossa, the jugular fossa, this inferior petrosal sinus, and this groove behind this is called sigmoid sinus passing through. This is sigmoid ridge or this is transverse groove. This is passing through transverse sinus. Transverse sinus ultimately making the sigmoid and jugular and sigmoid sinus in the jugular fossa or jugular bulb in the jugular fossa. Now structure passing through this one by one. Largest foramen, if you see, this is the largest foramen magnum. Okay, this foramen magnum structure passing through this. This is the apical ligament. If you see, one apical ligament. This is transverse part of cruciate ligament. This membranous part, membranous tectoria. This is part of the interlongitudinal ligament which form the membranous tectoria. And this subarachnoid space structure passing anterior and posterior spinal arteries and subarachnoid space. Two vertebral arteries, Here is spinal accessory nerve, and this lower part of medulla oblongata, lower part of medulla oblongata with meninges. Three meninges passing through following the medulla to spinal cord. Okay, this sometimes we have cerebellar tonsils. So this is called Arnold Cherry malformation. So, but mostly these are not present. But if present cerebral tonsils, that may be cherry malformation, unmolded cherry malformation. So these are the structures passing through this foramen ovale. So you have to remember, just above this foramen ovale, there is one canal opening here entered in this occipital condyle. This is occipital condyle. Here is one canal opening that is called hypoglossal. Hypoglossal canal. This or may called, this is the hypoglossal canal. So anterior to this you may find hypoglossal canal. Hypoglossal canal. So structure passing through hypoglossal canal is 12th nerve, hypoglossal nerve. And in this posterior part of this petrous temporal bone, one foramen is called, very important foramen for ENTs, is internal acoustic meatus. Okay, internal acoustic meatus. This foramen is called internal acoustic meatus. Structure passing through this. This is the, if you, I'm transecting this internal acoustic meatus, which ultimately formed by the three parts. This is the transverse crust, and this is the Bilswo, and this transection of this internal acoustic meatus. So, if it is, this is anterior, this is posterior, this is inferior, and this is superior of internal acoustic meatus. The structure passing through this foramen internal acoustic meatus is, this is facial nerve, anterior. Below this you may find that is cochlear part of axonal cochlear nerve, and superiorly you may have superior vestibular nerve, and inferiorly you may have inferior vestibular nerve. So this quadrant part, this is the Bilswo, this is the transverse crust. So anterior superior quadrant having facial nerve, posterior superior quadrant, superior vestibular nerve, and posterior inferior quadrant having inferior vestibular nerve, and anterior inferior quadrant having cochlear nerve. And one artery is passing through this, is labyrinthine artery. Okay, this is the labyrinthine artery. Labyrinthine artery. This is part of ICA, anterior inferior cerebellar artery. Okay, so structure passing through inferior acoustic meatus is mainly seventh nerve, eighth nerve, and this labyrinthine artery. Now we will talk about jugular fossa. Jugular fossa. This jugular fossa mainly divided according to Gray anatomy is two parts, anterior and posterior. Anterior part, if you see, this is the jugular foramen. Anterior part is small, that is called pars nervosa, and posterior part is large, called pars vascularis. This anterior nervosa having inferior petrosal sinus, 9th, 10th, 11th nerve. Okay, inferior petrosal sinus, 9th, 10th, 11th nerve. And this pars vascularis posterior part having inferior jugular vein or sigmoid sinus, jugular valve. Inferior jugular vein or inferior jugular valve. IJP ultimately upper part forming the jugular valve, and meningeal branch of occipital artery. Meningeal branch of occipital artery. These are the structure passing through this. If you will draw this like this, This posterior part is pars vascularis, or this is pars nervosa. These are the structures passing through foramen, this jugular fossa. Now this is here. If you see posterior most part of this eminence is called internal occipital protuberance. If this triangular area is called Vermilion fossa, which connect the, it's bifurcate this crust. Internal occipital crust is again forming this divided just above the foramen magnum, forming one triangular area is called Vermilion fossa. That is called Vermilion fossa, where vermis of cerebellum situated. Okay, this is all about entry of the skull. Now, skullbase. Now we will talk about part B, that is exocranial skull base, formed by 25 bones. Okay, this exocranial is extension form. Anteriorly, if you see upper incisor, teeth and arch. This upper incisor, teeth and arch, posteriorly up to the external occipital protuberance. This up to this superior nuchal line, external occipital protuberance, and laterally extend from this upper alveolar arch. This upper alveolar arch zygomatic mustard, both sides laterally, zygomatic mustard, and this occipital, superior and inferior nuchal line, mainly superior nuchal line, or sometimes may have supreme nuchal line. Above this may have supreme nuchal line also above the superior. This is the extent of exocranial skull base. Okay. Now main structure, if you see, it's also having three parts. Now again, I will divide this exocranial skull base again into three parts. Anterior skull base, anterior part, middle part, and posterior part. Now, anterior part extend from incisor, teeth to this free border of palate, of hard palate. Okay, if you see this is the hard palate, so free border of hard palate. Now middle part of exocranial skull base from free part of hard palate to the one transverse line passing through transverse line passing through foramen magnum. Now this posterior part is behind the transverse line, passing through anterior margin of foramen magnum to the external occipital protuberance. It means any approach of the mustard or suboccipital or retrosigmoid approach are in the posterior cranial fossa approaches, not the middle cranial fossa approaches. Okay. If you talk infratemporal fossa approaches are middle or lateral skull base approaches. It's in the middle cranial fossa approaches. Okay. Now main structure of this, if you see, in the entry part. This is the entry part. If you see this in the primitive palate, one is fossa is called foramen. This is incisive. This is called, now I have to remove this. If you see this is called incisive fossa. This incisive fossa is just like there's opening two. If you see inside this, two incisive canal. Inside this fossa having two incisive canal. Okay. This incisive fossa is single here, but having two incisive canal. So structure passing through this canal, incisive canal. Incisive canal. So structure passing through this incisive canals are terminal part of greater palatal vessels, which going through palate to nose. This the terminal part. Here is greater palatine fossa, greater palatine foramen. This is groove, greater palatine groove, which ultimately going vessels going through this incisive canal are terminal part of greater palatine vessels, and structure coming from nose to palate. This is called nasopalatine nerve. This is part of pterygopalatine ganglion. This nasopalatine nerve coming through incisive canal from nasal side to palate side of this terminal branch of greater palatine vessel going through palate to nasal side. This is incisive fossa. If you see in the, this is the palatine bone, transverse process of horizontal process of palatine bone. This is the maxillary process of, this is palatine process maxillary bone. In between you see this is the palatomaxillary suture, this is intermaxillary suture, this interpalatine suture. If you see this bone, this is called horizontal part of palatine bone. Here, one foramen is called greater palatine foramen on each side. Greater palatine foramen. Structure passing through this greater palatine foramen. This is also MCQ. Greater palatine foramen is greater palatine vessels. Greater palatine vessels and very important anterior palatine nerve, branch of pterygopalatine nerve. Okay, anterior palatine nerve and greater palatine vessel passing through this greater palatine foramen MCQ. So you have to understand this. You don't have to this make mnemonic and all things. You have to just understand. You will get it. Now behind this greater palatine, this is the greater palatine, and this pterygoid process, pyramidal process of palatine bone. This is pyramidal. Here it small two foramens, small two or three foramens. It's called lesser palatine. This is artificial scope. That's why not very much visible in this. This is called two or three foramen. Is called lesser palatine foramen. So structure passing through this lesser palatine foramen are lesser palatine vessels and middle and posterior palatine nerves. Okay, this is very important names. These are 2 and 3 foramen. Behind the greater palatine foramen of each palatine bone, lesser palatine vessels and middle and posterior palatine nerve passing through lesser palatine foramen. Okay. Now if you see the middle part, this is the middle part of the exocrinial skull base. Structure, this is, you can see foramen, lacerum, behind the foramen ovale. This is the carotid canal. This structure passing through this is the carotid canal, having carotid canal. Structure passing through carotid canal is ICA, internal carotid artery, and sympathetic plexus, which form the sometime contribute in the median nerve. Okay, this canal. And if you see this spine, this is styloid process. Okay, so behind this is one foramen that is called stylomastoid foramen. Stylomastoid foramen. So structure passing through this foramen are facial nerve, the vertical part of facial nerve, and artery, that is stylomastoid artery, branch of posterior auricular artery, ultimate branch of ICA. Okay, external carotid artery. So structure passing through stylomastoid foramen are vertical part of facial nerve and stylomastoid artery of posterior cranial fossa. And this anterior to this is the occipital condyle, is, you can say, hypoglossal canal. So structure passing through hypoglossal canal, that is hypoglossal nerve or maybe 12th nerve. And one emissary vein or sometimes the meningeal branch of the occipital artery may passing through this. And posterior to this is the posterior occipital, posterior condyle canal. Mainly it's blind. Sometimes structure passing through this is the emissary vein which connect the sinus, that is transverse sinus, to the suboccipital plexus. So posterior condylar canal, structure passing through this is the emissary vein connecting the transverse sinus to the suboccipital plexus. Okay. Now intercondylar canal is anterior to this condylar process of occipital bone, having the also called hypoglossal canal. Structure passing this is the hypoglossal nerve or emissary vein. Now this is the mustard foramen. This is the mustard process. This is the emissary mustard. This is mustard foramen, emissary mustard foramen. That is emissary vein passing through this mustard foramens. Okay, these all about this. And this transfer line behind this is all foramen magnum, that is posterior skull base, posterior part of the skull base. Thank you so much.